Good morning, everyone. I'm not noticing any more folks trickling in, so I think we can probably go ahead and get started. My name is Jessica McKee. I'm the Tribal Foundational Public Health Services Coordinator and Emergency Response Lead at the American Indian Health Commission. And I'll just pause for the other co-leads to do their intros really quick, and I'll pass it to Gabby first.
Hi, everyone. Hope you're doing well. My name is Gabby Hadley, she, her pronouns, and I'm the Public Health Emergency Preparedness and Response Manager for the Snohomish County Health Department.
Hello, everyone. My name is Travis Nichols. I use the pronouns he, him, and I am one of the co-leads for this work group. I appreciate everyone being here today. My job at Department of Health for the Office of Resiliency and Health Security is to act as legislative liaison. I'm going to be off camera today. I apologize. I haven't been feeling well lately, so thanks for your consideration.
Thank you. I'm sorry you're not feeling good. That's the worst. All right. I can't remember. Do we normally do introductions for everybody in this one? Okay.
People sometimes just drop it in the chat.
Perfect. Okay. If you are wanting to introduce yourself, please go ahead and drop your info in the chat. Here is our agenda for the day. We will, if there's anybody who's new and wants to introduce themselves, please feel free. You can raise your hand, and we'll call on you to do like a formal say hey to everybody. We will be going through and giving some updates from the quadrants. Oh, I see a hand from Polly. Go ahead, Polly.
Hey, I'm going to force an introduction. We have our new Public Health Emergency Preparedness Coordinator for Skagit County Public Health on the call. So Carson, if you're able to, can you come off mute and introduce yourself?
I see
Carson, are you
face.
still on mute? I think you're still muted. Anyway, you can happily see Carson's face. Carson comes to us most recently from Spokane Regional Health District, so we're super happy to have her on board. And she will be working with our Skagit team and will be adding to our great emergency preparedness efforts here.
Thank you so much. It's nice to see your face. I'm sure we'll get to chat at some point. Appreciate you being here. And let's see. Will you go back to the agenda slide, Travis? Thank you. So we'll go through and we'll do any updates from the quadrants in terms of how things are going right now. We are still working through our definitions technical work group review request. Last month, we kind of went through and talked about some language changes that we had made at everyone's suggestions and kind of started talking those through. But the goal this month is to try to come to consensus on those changes. So that will probably be the bulk of our meeting today. And then any implementation updates from the FPHS after hours call program. We have 2 items on here that are crossed off that were sent out, but we're not going to make it through those today. And then we'll talk through next steps because we still have another lingering technical work group request to work through in terms of the access to care definitions. And then also one more. My brain is blanking right now. Gabby, help me out here.
Evaluation will be next.
Evaluation. Yes, thank you. And I just had that big long all day work group with them on Friday. So there is one lingering request from the technical work group for evaluation, and that's coming up with some measures. I got to peek in and listen in on their all day meeting last week on Friday, and it seems like most groups are submitting like 10 of them. So I think it will be not as hard as it sounds for us. All right, next slide. Thank you. And for this one, sorry, Travis, I know you're trying to not talk a lot. Is there anything that we had in mind?
This is where we do updates from across the system.
Okay. Did anybody have anything in mind that they would like to share in terms of updates from across the system here? I know we mostly have EPR folks. I can just add, in terms of like the health equity piece, I know there was some discussion around some of the groups in their definitions, trying to build equity into their definitions as well. And the evaluation work group, when I sat in with them, they were also talking about making sure that that's apparent in that ask from the technical work groups as well. Sorry, toddlers. And let's see. In terms of the tribal FPHS work group, we are also slowly working through the definitions in terms of a crosswalk. Because that is part of the intention for the definitions work group is to be inclusive in their definitions. And I'll just pause here and see if anybody else has anything to add in terms of system-wide updates. And then I see a question in the chat here. Is there anything interesting happening at the steering committee level? That is a great question. So I know in terms of getting prepped for decision packages, that is going on. We are preparing for decision packages. One would increase the total going to tribes to a 10%, which is in line with the National Indian Health Board's recommendation as a more equitable amount to go to tribes. So that's one decision package that's being kind of worked on. And then another one is set to increase us to give a small increase to kind of help everybody be able to maintain what's going on with the work that they're doing. Chris, do you have anything that you'd like to add in terms of what's going on at the steering committee level right now?
I just got in, not sure it was quite covered already, but nothing to add to that except the work of the technical work groups continues marching on. The other subject matter expert work groups have been diligently plugging away at definitions and evaluation requests as well. And they've started reporting out to the technical work groups to get feedback. And so far, the technical work groups have been very receptive and thoughtful in taking that feedback. And I think probably each group will have some follow-up as well. And we can expect that too.
Thank you so much. Does anybody else have questions around kind of what's going on in the system right now before we scoot on? Okay, I'm seeing shaking heads and getting silence, so I think we could probably move along. All right, so the definitions technical request. So like I said, we kind of went through the process of overviewing some of the changes that we've made, just to kind of workshop the new definitions based on you guys' feedback. And that was last month. We are aiming to get these definitions over to that work group as quickly as possible because they will be presenting, they'll be going through and kind of reviewing them at the work group, but then they'll also be presenting those to the steering committee in September. So that's kind of the timeline that we're on for that. And then in addition to the EPR definitions, we are also going to be working through some access to care definitions and kind of keeping in mind from the emergency preparedness side, you know, kind of what was our feedback on the access to care definitions. Next slide, please. And then just some reminders on the requirements for definitions. The goal is that these things are unique to governmental public health, available in every community, and they're population focused. Next slide, please. Or if this is where we're pulling up a spreadsheet too, that That works for me. Okay. And then Chris, if it's easier for you to do the polling and stuff without sharing the spreadsheet, I'm happy to share too, whatever works.
For consensus polling, I don't think I'll be able to run any polling. I'm on as a guest in browser mode is the only way I could join.
Okay. All right. So we might have to do some old-fashioned raise your hand if you disagree kind of polling. Do people feel comfortable with that?
I see Travis in the chat says he can set them up. I can put the language
Okay.
to easily copy from in the chat too.
Okay, cool. Okay. And then just a reminder and intro for those who are new, this is a consensus-based work group. So our goal is to get to an agreement on everything. And if people have concerns or questions, we want to hear what those concerns and questions are to make sure that they're comfortable with decisions before we move on. So as we go through these definitions, we'll be working on consensus polling to make sure that people feel good about these definitions that we're working to come to agreement on. If people have something that they feel like, this definition wouldn't allow me to do what I need to do at my job, we want to hear from you on those items.
Jessica, do you want me to share the Word doc, or do you want, I don't think I got the definitions to Chris in time to get them into the spreadsheet. So I don't think the spreadsheet's been updated. So I'm just going to share the Word doc if that's okay for you.
Works for me. Whatever works for you guys. Thank you so much. All right, and so for those of you who were not here last month, because I know we had some overlap with conferences and stuff, kind of the way that we started off the conversation was that we have rearranged the definitions based on you guys' feedback to reflect the emergency preparedness cycle. So you'll kind of see that rearranging throughout here. But the first one here is planning. So ability to develop emergency response plans for public health, medical, and mortuary services using a threat-based all hazards approach. So the things that are crossed out are things that were taken out completely. For some things, they were kind of rearranged. So I hope it'll be clear when we get to those items further on here. But do people feel like for planning, thank you, Travis. Give people time to just look through and see if they feel like for planning that this is a good definition. And then I see Chris put in the chat the language for the polling, so we can prep the poll. And if you guys feel like too, maybe you want to do like a little bit of a landscape scroll through things before we start polling, let me know too. Like I want it to make sense to people and feel comfortable. And I know if you weren't here last month, things are rearranged quite a bit. So I'm happy to help us navigate through however. Go
Hey,
ahead, Gabby.
Jessica, this is Gabby Hubbard. I'm just clarifying the process that we're doing right now. So, are we, oh my gosh, my words, I'm so sorry. Are we, do you want us to do consensus based for each of these boxes? Right now, do you want us to give like verbal feedback to you? I'm just looking for clarification on like what you need from us
Yeah.
and what process we're using right now.
Yeah, maybe it's not clear because I'm looking for feedback from you guys too, on what would make the most sense for you. So if you weren't here last month and this is your first time seeing this, does it make sense to kind of zoom through and look at everything and, you know, kind of get comfortable with where things are at before we go back through and then do consensus polling? Or do people feel okay with just tackling each one at a time? Go ahead, Chris. You're muted.
Definitely having some time or walking through these a little bit before any kind of polling would be a good plan. And one thing
Okay.
about the polling is it can be used for process just as well. So if we take some time to work through these briefly, we can ask the group as a consensus poll, do we want to poll on everything? Or we can say, we approve all of these. And then either everybody agrees or somebody doesn't. And if somebody doesn't, then we have further discussion about whatever they want to talk about. So that's part of the beauty of this is it's a very adaptable process. And it is intended to encourage and invite discussion.
So like we
And
could go through all of planning and then just vote on planning as a one chunk. And then if someone's concerned about 1X number 3, because they're not labeled quite yet, then we can zoom in and have more discussion on that.
That sounds like a good plan. And sometimes
Okay.
it'll be like first time, great. And sometimes it won't. And that's great too.
Okay. And I saw Jessie Chapin had her hand up, so I just want to loop back and make sure. Did you have anything that you wanted to add, Jessie?
Yeah, I just wanted to say that an overview would be great for me. I wasn't here last month, and at the risk of my professional reputation, I don't really have any idea what we're doing here. So
No problem.
if you want to, I was actually planning to reach out to Travis after the meeting in case I was the only one who went, okay, wait, what are we doing? So if you can do a little recap for me,
Yeah.
or if I'm the only one who needs it, let's just do it afterwards, but I do want to be helpful.
You are definitely not going to be the only one, Jessie. We got you. Go ahead, Gabby.
I can start answering that, and then Jessica, feel free to kind of add in. But yeah, Jessie, totally fair question, not a problem at all. So the steering committee for FPHS has asked each of the subject matter expert working groups to go in and review the definitions that pertain to their subject area. For us, we have 2 areas that we've been asked to give feedback on. And so the one that we're doing right now is the emergency preparedness and response definitions, which you'll hear us describe as EPR. And the thought is that these kind of outline what we can like spend our funding on. Like it kind of helps to outline like some of what's in bounds, or like what does EPR mean within the context of the FPHS system. And so the steering committee asked us to really keep these at a high level, so to not get, super into the weeds with the edits, but really call out things that structurally are maybe impeding what we can do with this funding, or maybe are an inaccurate understanding of this body of work. So what we're going through today is a restructure of those definitions. So this group has met a couple of times now and provided feedback. And one of the big areas of feedback was that the definitions, the buckets of topics were kind of hard to follow when you were reading them. And so we reorganized those, like Jessica mentioned, to kind of match the planning cycle or response cycle. I forget which one at this point. Sorry, y'all. So to match that. So that's really just what we're looking at today. And feel free to add anything to that, Jessica and Chris and Travis.
Thanks for backing us up for the big picture, because I to just jump in and start going on stuff. I would add like just the feedback that I've heard too is you want it to be specific enough that like your finance people and your administrators are cool with how you're spending the money, but broad enough that it can be inclusive for people and they're not like missing out on the opportunity to use the funding for things because we were too specific. So it's kind of going to be a weird balance. And I know Travis is trying to open this up in a different view so we can get you the clean markup version and it's not quite as rough looking as it was before. But does that make sense in terms of kind of what we're working through and kind of what we're trying to look for in the definitions?
Definitely very helpful to me. Thank you.
Okay, awesome. All right, so the first of the reorganized categories, this is planning. So ability to develop emergency response plans for public health, medical, and mortuary services using a threat-based all hazards approach. And then I'll probably just pause for a few moments in between each one. And if you have like a question or a comment, you can voice that and then we can scooch along to the next one. Go ahead, Sierra.
Let me come in camera so you can see me. So I went over this with my lurk and my work. And from a like deliverable standpoint, ability is, do we have ability, yes or no? For me, so it's like I'm thinking about like a mid-year report and it's like you're asking me, do I have this ability? Is that just a simple like, yes, we do, no, we don't, versus like we'll maintain an emergency response plan, we'll update, we'll provide. I need like something tangible that I can say like, yes, you're asking for this process, this policy, this plan. Whereas ability is very nebulous to me. And just kind of a side note, I come from like a federal compliance background with like the grants I'm used to working. So I'm used to that very clear, like, this is what I expect you to provide. Or this is the demonstration I need of like the ability to develop means we've done these classes or we've done, this work to show evidence that we have the ability to. That's all I have feedback wise. You guys are doing a great job.
Thank you. I appreciate that federal compliance background piece because I know at the tribes too, like they're very audited and so they'll have the same concerns. Go ahead, Chris. You're muted again. And I'm gonna turn it into a game.
And so I hit a button and okay. A little bit context again for the definitions, and this is something that all of our subject matter expert workers are. We have to keep reminding ourselves and staff too. The definitions are not a prescription; they are permissive. So largely, by far and large, we think about how they are used by the system, how are they applied, and this is my agency is receiving these EPR funds. How can I spend that money? I look at my statement of work and I look at the definitions, and so whatever I need to do to have the ability to do these things is what I'm spending that money on here. Ability to, I think, is a key phrase across the definitions because it is loose and permissive. There's no expectation in the definitions that every recipient of services must deliver all SCHS individual items themselves completely. So this is not a prescription, but it's a permissive document. And the ability to also frequently mostly shows up in the main heading for each section. Like here's planning, and all the items underneath are the specific parts of what's recommended, what you can spend funding on in order to do the things above. So the items below are kind of like what contribute to the ability to, and kind of that context. It kind of helps, I think, organize it too, in at least my mind. I hope that's helpful.
Thank you. That's very helpful. I was just looking at it because of an individual like task deliverable, so that gives me context. I will probably redact most of my comments at this point.
Yeah,
No
I think
worries.
the sub definition bullets are probably where we'll find more of those.
Yeah, and I would just add to like some of the feedback that I heard on the evaluation group, not to confuse our asks here from technical work groups, but a lot of them were related to capacity and expertise. So I think if there are anything where we can, if it would make people more comfortable reword, maybe we can approach that language because it's still kind of broad and nebulous, but might make people more comfortable. We can talk about that if we run into more items like that, but Any other questions, comments, concerns on number 1 before we move into the sub definitions for this section? All right, I'm just gonna keep reading. You guys are gonna get tired of my voice. So 1X number 1, develop and sustain mutual aid agreements with and among the Washington governmental public health system and other partners, including tribal nations, healthcare, private sector, and community-based organizations. I'm just gonna count to like 15 Mississippi in between. So that's your, I'm moving on to 1X number 2. Maintain written procedures for emergency support function 8, public health and medical in the state, county, or municipal comprehensive emergency management plan and/or the public health response plan. Written procedures should include specific procedures to address needs of vulnerable populations based on risk assessment. All right. And could you scroll down just a little bit, Travis? I do see a comment from Nick in the chat that vulnerable populations is outdated. We could say priority populations instead. Anybody else have any comments or feedback on that suggestion? Go ahead, Chris.
Quick question. Written procedures should include specific procedures. Should that be written plans should include specific procedures, or is that as writ best?
I think since this is about, well, we say maintain written procedures at the beginning. It is kind of a weird way to word it.
Just checking.
You are correct. Anybody have suggestions on how we should change that?
I
Should it be
agree
written
that
procedures?
the first sentence should be maintain written plans, and then written plans in that last sentence should include specific procedures.
Okay. We can also, I see Chris put in the chat for the last sentence, just say written procedures should address and kind of take out that additional specific procedures verbiage there.
For me, procedures sounds more like an operational document rather than an overarching plan. So there's a difference to me between those two words. So it's whatever you're really looking for. Are you looking for operational, like a checklist, procedures for some of this work, or are you looking for the overarching plans and then drill down into the operational work?
Yeah, those are some great questions to think through. because we do have in here specifically listed the public health and medical for the state, that plan, and then the public health response plan. And it's in the planning section of our definitions, so it's very plan oriented. And I see Brian put in the chat that Kitsap's ESF8 document is a plan, not a procedure. So I'm hearing people leaning towards plan.
Yeah, that's how it is at the state as well.
No, within that plan, there are procedures, but it is not a procedure in and of itself. It's a plan with procedures.
Exactly.
So maybe maintain written plans at the beginning, and then the second sentence, or yeah, that is the second sentence. It's really long, sorry. We could say written procedures should include, because that would include kind of the procedure piece of the plan. Does that sound like a reasonable way to approach it? Thank you, Travis, for editing on the fly for us. I see Sierra has her hand raised. Go ahead.
I'm just kind of musing out loud. So we pulled from Seeking, particularly for this population and based on procedure. Even theirs, which is very thoughtful, is not very procedural. It's more like, think about these factors, make sure you have these plans in effect. It's not it's not like a step-by-step process. And so for me, I look at that and think I need to have like a how-to manual within the plan. So I don't know if there's a way to nuance that out a little bit. But that's the one that we pulled from for our stuff in particular. And I think Brian, who's our planning staff, probably has more info on that too as well.
Yeah, go for it, Brian.
But it then say plans should address the needs of priority populations based on risk assessment.
Yeah,
I
that
would
it kind of,
agree.
no matter how your plans are laid out, that's inclusive of you needing to have that. Thank you, Brian. Any other feedback or suggestions on this one before we move on?
I want to make one more.
Go ahead, Brian.
So being from the military, does that mean could, which means might, which means, or is it plans shall address, which means must? Should is just, yeah, it's okay if they do, it's okay if they don't. Do we want them to address the needs of priority populations? Then it should be instead of being passive as should, it should be that active plans must, or some active phrase.
Yeah, so I see Chris has his hand raised, but I think for you guys, like, if you're looking at these and justifying spending funds with these definitions, what would your preference be in terms of should or shall?
This is Jesse. I think there's nothing worse if you're trying to spend these funds than for there to be a gray line. They either should, or there's no reason to put it in there, or you say you lay out guidelines that should be followed. Because when, obviously if you're managing a grant, you're looking for what the deliverables are, what it needs to look like. The should is a nightmare to me, and I'll let other people speak to that, but I want to know exactly what does this need to look like to be its best, to be what DOH wants to see. Yeah, so that's my bias.
And I see Brandy put in the chat shall as well. Then Chris has his hand up. Go ahead, Chris.
Coming back to the purpose of the definitions, they're not prescriptive, right? So to get away from the should, shall issue, the way this would show up, if we're going to add that part in, because that was an addition that we brought in as a group, the way to do it likely would be to maintain written plans that address needs of priority populations based on risk assessment. Which in my interpretation is effectively a shall. but that reflects the maintain written plans is at the top already.
Yeah, so instead of 2 sentences, we're gonna have one big giant one. Is that what we're thinking?
Maintain
Maintain
written
written
plans.
plans,
Mhm.
yada, yada, that address the needs. Okay. Thank you. Thank you, Travis. All right, how are we feeling about that one now? I'm seeing thumbs. And not hearing anything else. So, okay, Brian says good. All right, we'll scoot on to the next one. So develop and maintain a public health preparedness training and exercise plan. Ensure training addresses how the ESF8 response and public health response is coordinated within the jurisdiction's incident command system.
This is Jessie, and I do training, planning, and exercise in ORS. I would like to see somewhere in here that they understand there's an expectation that they will participate in and attend the DOH IPPW. And that is all about development, maintaining, and communicating what their training and exercise plan is. Is there a way to, or not attend, but if they would participate?
Jesse, is there a way to do that with, is there something around the intent of the IPPW that is not DOH focused or not centralized at the state level? Like, what's unique about the IPPW that, or that process that we can incorporate in this language that doesn't like link to a specific?
Thank you. Well, the purpose of the IPPW is to gather the needs and also identify gaps that exist in training and exercise at the local health or tribal health level that DOH can provide support to. We do develop a statewide improvement plan. And so developing and maintaining public health preparedness training and exercise plan, local health jurisdictions can adopt language that says we are going to participate in the, I guess it wouldn't be required to, but they can participate in the state plan and actually use it as their own. So it takes that, we try to lighten the load at the local level if we can. And if they participate in the state IPPW, that could literally serve as part of their local training and exercise plan.
And I think my issue would be, develop and maintain is broad enough that they can be developing and maintaining them however they need to within this funding, right? So if it's in CONCON already and locals are already using it for that purpose, I think the definition captures that. I don't know
agree. Yeah.
Okay.
Well, see that. Thank you for the conversation. I'm somebody who sometimes, if I can consult, I can see the ridiculousness of it by the time I get to the end of my sentences. So
not ridiculous at all, right? We want people to be funded to go do the things, right? So this is part of us making sure that happens, coming up with the definitions together.
And I really focus on, not how can we make it more difficult, but how can we help? How can we lighten that load at the local level? But I think that what I said right there definitely isn't going to lighten the load. So thanks.
Yeah, and then I saw some hands go up and go down, so I don't know if that was a wave or I can start in the virtual wave. I'll just pause though before we go to see if anybody had anything else they want to add or concerns with that definition. Okay. So the next one in the blue box at the top here, so 1X, I don't even remember where we're at now in, in the block. Maintain a continuity of operations plan for the agency. Plans include definition and identification of essential services, line of succession, written delegation of authority for select critical positions and protocols for temporarily discontinuing specific functions to sustain critical services. And I see Chris has a hand raised.
Yeah, just kind of a point of order that might make this easier. I think a lot of these are included simply because we moved them into our new categories and didn't actually edit them. And I think, and maybe Travis can confirm or correct, the ones that don't have edits shown are just as is from the original definitions and have been reviewed and left alone already.
I don't think we can quite interpret that this way. There's a lot of changes, formatting and otherwise, that make it difficult to make that interpretation, and even in the clean markup. But Chris, your point stands. A lot of these are unchanged points of language, and it's that's one of the downfalls. It's neat to see everything in this single clean version of a Word doc for word editing, but the downfall is it's difficult to do the comparative work to the previous definitions that the spreadsheet allows. So we apologize that that's not easily visible in this version, but Chris is right. This language is unchanged from the existing definitions.
Thank you.
Yeah. I see that now. I'll try to keep an eye on that. This particular one is unchanged. The next one has some small edits in it.
Okay. Maybe give me a heads up which ones have edits, and then I'll just only focus on those. I can't really tell from my view here. So the next one, define roles and responsibilities of public health leaders in establishing short-term and long-term community recovery and response closeout goals.
For this one, what was edited was the and response closeout was added.
Yes, because we did get feedback that people wanted closeout activities to be something that they could fund with FPHS. Go ahead, Gabby.
Thanks. I'm proposing that we remove leaders and we just put public health here because recovery is usually a whole of government or a really collaborative process, and leaders seems unusually restrictive.
Right, how are folks feeling about that suggestion? I see a thumbs up and an agree in the chat. Okay, cool. Thumbs up again. A few more agrees in the chat. That one's getting a lot of traction. Cool. Done. And then Duncan is asking, what is a closeout goal? And I don't remember who suggested that language, Chris. Did we
Is
have it
that
tracked?
like an end state?
Yeah, so closing out the response. I'm not sure if the verbiage closeout goal was how they phrased it previously, but I think that it was.
The term closeout goal, if I remember, came from actually a definition somewhere because it was recovery and close out. So it's how do we close out of a disaster, out of an emergency? What are the goals? Is it to return it back to its original? Was it to return it back? And that's a closeout goal, not a recovery.
Okay, and then I see a comment from Nick in the chat that he agrees, not familiar with closeout goals. I think we might want to say something around transitioning from response to recovery instead. All right, so maybe define roles and responsibilities of public health in establishing short-term and long-term community recovery. Well, we got recovery there already. And then I have a question here from Cassie that I just want to clarify on too. Kind of clarifying, is this discussion specific just to the subject matter experts or everyone on the work group? And if you're on the work group, you are considered an SME, so please feel free to chime in. unless you're staff, I guess, but even then, please chime in. And Nick put in the chat a suggestion: define roles and responsibilities of public health in transitioning from response to short-term and/or long-term community recovery. All right. How's that looking to folks? Got quite a few thumbs up in the chat for the suggestion, so I think we're good. Okay. Oh, it blurred out my thumb. Sorry, guys. Weird background blurring. All right, I'm going to move us on to the next one. Maintain an emergency notification system. There's some examples in here, and include all critical public health response and leadership positions and essential partners as appropriate as registered users.
Both the ones that start with maintain are as writ in the original and unedited by this group.
Perfect. Okay. So we'll skip over those. Develop, sustain, and ensure surge capacity plans as part of ESF 8 response plan in the areas of environmental public health, epidemiology and surveillance, medical countermeasures response, incident command, radiological response, healthcare response, may include but not limited to acute care, blood, dialysis, long-term care, emergency medical services, and mortuary affairs.
For this one, what was added was ensure, was ESF 8 response, and the mortuary affairs.
Thank you, Chris. All right, hearing nothing, I'm going to scooch us along. Evaluate, plan, and prepare for supporting populations likely to be disproportionately impacted by emergencies.
This is one that the group came up with as a new one, and it was paired with one that was train the staff, which I think will come up later.
All right. And I think we might have just rearranged this one a little bit, but I am not remembering totally. Conduct needs, risk, threat, hazard assessments. So all the different assessments.
This was an addition, new one.
I'm shortening from counting to 15 Mississippi to counting to 10 Mississippi, guys. I see from Gabby, supporting populations, vulnerable populations, priority populations. Are these all the same? What do
I
folks
think in
think?
this context, supporting is the verb. So do we mean supporting priority populations?
Oh, disregard. I read that wrong.
Okay.
Sorry. Sorry, Chris. Thanks.
Good to go.
It's all good. Right, and then Travis asked if anyone's willing to propose sharper language on the threat or risk assessment statement definition.
So I think if we're talking about things that so each one of these is an item that we can spend FPHS money on. I think leaving that one fairly broad like it is, conduct needs, risk, threat assessment, hazard assessment, is right where it should be. If we constrict it anymore, it may leave things out. And since these are things we can spend money on, I think that's good.
Thank you, Brian. We have another comment in the chat from another Brian. Conduct hazard vulnerability analysis. Do we feel like the way that it's worded now, hazard assessment is not accurate or is restrictive in any way?
So then we have to, if we go with hazard vulnerability analysis, the DEM for Kitsap County is now doing threat assessments. So I think leaving it, because hazard is in this one, maybe it's hazard vulnerability assessments, and we just add vulnerability in after hazard and before assessment. That might give Brian also what he wants, or what is missing.
Thank you. I have in the chat here, there's another suggestion. Conduct assessments to determine needs, threats, risks, and hazards. Could be an alternate. And then I have a comment from Duncan in the chat here. Isn't the sentence above conduct just a subset of the sentence? And how does one evaluate a population?
The distinction, I think, with that one, I believe it was health equity minded to explicitly give space and funds for assessing populations that are likely to be impacted disproportionately, whereas the conducting the needs, risk, threat, hazard, vulnerability assessments are far more general. Some of the reasons for adding specific definitions has been simply because some folks need to be able to point to something that says they can do a thing. And we try to make that available when it's been an issue. And this kind of area has been problematic sometimes with some boards of health from the LHJ perspective.
Okay, I saw a lot of thumbs up happening. All right. So this one, develop and maintain strategic partnerships with local agencies, nonprofit organizations, private sector, healthcare organizations, state agencies and associations, and volunteer organizations. Then we threw in a bunch of examples to support public health preparedness, response, recovery, and resilience efforts.
For this one, we added the volunteer organizations and the word response.
All right. Thank you, Travis. All right, so the last one for this section, work with community leaders, partners, and organizations serving vulnerable populations to develop effective, got an extra word in there, effective communication strategies to share public health and healthcare impacts during an emergency.
I believe this one was brand new.
So do we want to keep similar language and think about that vulnerable populations term and keep similar terminology through the document?
Thank you. And I do have a question on this one as well. If we're talking about communication strategies, what are we sharing? I don't know if I like share as the word. Because we would be, if there's an emergency, there'd be kind of like an education component a little bit. What are people thinking? Do people like share there? I'll defer to you all, but
Is it about providing information?
yeah. So maybe there's a suggestion that communicate might be better. Inform might be.
I like inform.
Okay.
And is
Otherwise, we've
this
got
public
communicate.
information?
Yeah, that's a great question. Who are we informing? Are we informing the public of public health and healthcare impacts? Or I would think of it more as like the external communication.
Probably.
So maybe communicate public health and healthcare impacts to the public during an emergency.
To provide communications related to health, public health and healthcare impacts during an emergency.
What was the proposed change? Jessica, what do you want to change, if anything?
Sorry, my brain is still trying to like look at this one. I don't know if it's because it's the last one in the section or because I'm trying to be really clear about communication and I'm being too specific myself. So work with community leaders, partners, and organizations serving priority populations to develop effective strategies to communicate public health and healthcare impacts to the public during an emergency. I feel like that flows okay now. Brian, what did you added more, I think.
No, I just moved one word, effective strategies to communicate the impact,
Okay.
the public
Yep.
health and healthcare. Yeah, the impact to public
Oh,
health and healthcare during an emergency.
The impact to public health and healthcare. Boop, boop, during an emergency. To the public during an emergency. Do we want to the public there still after healthcare?
The impact of public health and healthcare to yes.
Okay.
And then the first two after impact, the impact of public health. The public health impacts, that impact word is just in the wrong spot, no matter where we put it.
We can change it back if we like something else better. Oh, that's not even the one we changed. Sorry. Don't listen to me. I need to drink more coffee. and just
I'm
read.
reading Chris's.
Jeez.
Don't want to confuse, but what I put in the chat is a definition from the communications definition area. And they added community engagement and including during public health emergencies to that as their recommendation. I'm not sure if it replaces the need for it here. It's kind of nice to have two avenues to get at it, but it's similar and I think it'll work nicely with it.
And I think that community engagement piece might open up some more activities like for people in terms of response work and engaging folks right away. I know that was something that came up quite a bit during COVID.
That public at the end, can we change that maybe to their constituents? Because it seems to be you're referring to 3 disparate groups of people, community leaders, partners, and one subset, organizations serving priority populations. So you're, I think, asking to talk to their constituents and not the generic public.
Okay, so what change do you want?
So instead of to the public, it would
Yeah.
be to their constituents.
Or some variation of their constituents, because you're asking that, particularly the group serving priority populations, to communicate with their priority population, right? Not the generic citizen.
With their population.
Yeah, that would work. Does double the
Okay.
population word in there, though. Can't blame.
So we have, working, so the community leaders, partners, and organizations that are serving specific populations, working with them to develop effective strategies to communicate with their populations. Does that track for everybody? Okay, I'm seeing 1 thumbs up. Are folks thinking we want to do the other sections and then do consensus? Oh, sorry, go ahead, Chris.
I'm just seeing communicating the impact of what?
I think the 2 after impact, the impact of or on public health and healthcare.
The impact of what on public health and healthcare? Of the emergencies?
Understand what the question is? Yes, I'm.
Okay.
How about the emergency's impact on public health?
I like that.
Should we include it as an avenue for recommendations or changes, thinking about what information these populations aren't receiving?
Yeah, because if you're right in an emergency, we're not going to say, hey, populations, there's an impact of public health and healthcare necessarily. We might be wanting to include some of the suggestions for sheltering in place or whatever, right? So is this broad enough for you all to be able to do that right now?
If we wanted broad and inclusive, we could just say about the incident, ongoing information, something along those lines.
To communicate with their populations regarding the incident. Work with community leaders, partners, and organizations serving priority populations to develop effective strategies to communicate with their populations about the incident. That's what is making sense in my brain, but I don't know if that captures what all we need it to capture.
Could be about public health emergencies, about current incidents.
Sometimes the solution is to just take it back and be more simple about it. All right, I'll give us a few seconds here so folks can think about it and read. Okay, seeing thumb. So in terms of how we move forward now, do we want to go to the second section and start working through? Do we want to try to come to consensus on the first section? What feels comfortable for folks?
Do you mean, so are you talking about right now or at the next session or?
Right now, where are we going next?
Okay, I have to step out, but I will leave that up to the group.
Okay. And Chris is giving us a little cheer in the chat because section 1 was the biggest. So go team. Okay, and Travis is going to zoom through and highlight kind of where we made some changes here so we can track. Okay. Alrighty. So I'm going to just go through to section 2. I'm going to take the painful route unless somebody tells me they want to vote on things. So section 2 is the training and exercise section. Good, Jesse, because we're on the section that you will like the most. Training and exercise. So I'll just get us started with the section, the main section definition, and then we'll kind of do the same thing and scoot through all of them. So training and exercise, the ability to train public health responders on all relevant emergency response plans, ESF 8 roles, and to evaluate plans and capabilities through routine exercise. Go ahead, Randy.
It's kind of back to that one we talked about in section 1. I don't love the wording of the ability to train. I think we should just drop that and just say train public health responders. Because we do all possess the ability to, so that's super generic and I don't find it very helpful as opposed to, and it kind of goes back into that shall, should thing where like, yeah, you have the ability to, but you didn't necessarily have to.
Thank you, Brandy. Are folks feeling like they wanted to for these main section definitions and just say the thing that we're aiming to do?
This is Jesse. I agree. I like the clearer language. We just had this conversation in reference to a different thing, but the other thing is if they say they have if we're just asking them to have the ability to, they could say, well, we had the ability. I mean, we didn't do it, but we had the ability, and that's what you wanted us to have. So I think that getting rid of that passive language as much as we can will be helpful for everybody.
All right. Well, let's
Chris,
go
do you
ahead
wanna-
and get rid of.
You want to make the case again for adding the ability to?
Yeah, I can recap that too. But I mean, we can always make the recommendation. The flow of this is we'll make a recommendation to the technical work group, and they'll make a recommendation to the steering committee, and they'll make the final decision. But the ability to, again, comes in only really at that high level of summary for this entire category. And it's not a prescriptive document, but a permissive document, right? So this is, the things below are the specific tasks that you can spend your funds on. The funds are here to provide the recipient agency the ability to do these things. And so it's really just kind of capturing what the money is doing. The money itself doesn't plan, it doesn't develop, it doesn't conduct. The money provides agencies the ability to do those tasks that are listed beneath it. So we can definitely make the recommendation to strike the ability to and just leave it as train. To me, I think it's fairly semantic, but for consistency with what else is in there, that's why it's there. And some of the context surrounding that. Yeah.
Chris, thank you for that explanation. That makes sense to have why that ability to is in there then.
It's
Yeah,
also,
so
I think,
I'm
a little bit more
noticed.
permissive. Sorry. Because with the recipient of the funds can spend the funds on what they need to do to deliver the service. And what you need for your particular agency in your particular situation to serve your particular population varies sometimes. And I think that's a bit of kind of why it was in there too. But yeah,
Thank
the
you, Chris.
sub-bullets are much more specific.
And then I see Jesse put a comment in here. Some agencies have said they don't have the ability to because they do not have enough staff. So ability to, right? If you're not able to because you don't have staff, this would be affording you money to get staff, potentially. Does that feel like broad enough?
This
And
is
then I
Jesse again, and I really appreciate the consultative nature of this group. You know, now that Chris mentions that, I do see what he's saying, and I don't know that taking ability to out doesn't really change, right? Doesn't change the impact or what they can or cannot do. So if the group, I will defer to the group. Ability to is certainly, that's the word I'm looking for. I don't know. It seems like it's a choice. It's an option they could take, but they don't have to, right? They don't have to spend this money on that. They can do otherwise.
Thank you all. This was great discussion. And I see Chris put in the chat as well that we can also kind of talk with the definitions technical work group too about just that phrasing of ability to in general and kind of how, how's that being approached in other groups? And is this verbiage kind of helping the system or maybe making things more restrictive or confusing? Go ahead, Brian.
So I was just thinking, if we think the FPHS funds provide the ability to train public health responders, and then all the stuff below it is ways that we thought that they could. I don't know if Jessica provides the ability to, does that add anything for you or not?
I think that question's for you, Jesse.
Oh, okay. I'm sorry. I don't ever go by Jessica, and there's so many of us that.
I was questioning myself. Am I
yeah.
calling you Jesse just being weird? But I was like, no,
No.
I remember her picking that one in a meeting.
I'm sorry, I'm sorry, Jesse.
No, Brian, it's totally okay. But it is true that then I often don't think it's me. And yes, it does. It really does. And you know, if like I said, I was at a conference when the last meeting was held. I love this kind of work, but I think that it feels like I'm kind of one step behind the group. So I'm going to try to be quiet and learn. But again, this is the second time I've said something and I went, okay, I misunderstood the point of this. So, but yes, Brian, thank you.
All right. And then I see a comment from Sierra. Some of these qualifiers at the top of the document would be helpful about how we came to the decisions on some of this language. That way leadership can look at this and understand. Otherwise, they're gonna have to explain it and all the reasoning from conversations today. So I hear you, and I see you're getting some thumbs up as well. I definitely understand having to kind of take it back and explain to folks kind of how we got here. So we did have in a spreadsheet kind of the suggestions that came from other folks and conversations tracking the changes. Chris, Travis, what are we thinking in terms of kind of recapping these conversations today for folks to be able to take it back to their leadership so they can kind of understand the track that things took?
Yeah, the final product is not a Word doc. It'll be back in the Excel spreadsheet. So you'll be able to see the iterations. And then, there's 3 central questions that you covered at the beginning of this conversation, Jessica. Is it government in nature? Is it available everywhere in the state, et cetera? And so that'll be part of our reporting back to the technical work group. And those notes will be helpful, but clearly your participation is the best way to really get involved and understand the ask and what the work that's happening. So we'll do our best to try and relay all of this to the technical work group when we meet with them as co-leads to share kind of what the group's ideas and where they were coming from, and kind of relay the key points in our suggestions.
Thank you, Travis. And I see Brian has his hand up.
So Chris and Travis, this document though is meant for the co-leads to brief the technical work group, who will then make further recommendations, and eventually out of it we will get a document that states this is our recommendations, or this is what FPHS funding definition is, and here are the definitions of what is acceptable to use the funding for. But that is not going to be this exact document. This exact document is for the co-leads to utilize to brief their personnel, correct?
I think it's a little bit simpler than that also. Mind if I share a screen, Jessica? I'll just show you what it looks like. Travis, go ahead and speak if you like.
Yeah, while Chris is pulling that up, I do want to acknowledge that yes, this group operates by consensus, so we're not going to put anything forward that this group doesn't feel confident in, right? So, as co-leads, we're not going to represent anything that this group doesn't have the opportunity to give voice to and inform and ultimately come to consensus and agreement on what we want to put forward. But it is correct that from there, our work group collectively is providing recommendations to the technical work group. And from there, the technical work group is then providing recommendations to the steering committee. And the ultimate decision-making about what the definitions are and constitute lives with the steering committee. So our work group is absolutely committed to consensus-based decision-making, and we're not going to move forward without anything that isn't supported by the group.
Yeah, just reiterating that basically, we will send the written recommendations prior to the meeting with the technical work group, where it's mostly just a Q&A session. They ask for clarification. We talk a little bit about our process, and what we're sending them is going to be similar to what we were working on today. We were hoping to update the spreadsheet, but we weren't able to in time. I'm just going to share that really quick here.
But for myself or anybody at the local health jurisdiction, this is not the document that I would use to brief my chain of command right now on what's going on. I would wait for the steering committee's release of their document once everything has gone up and been worked through the steering committee.
It depends on whether you want to share with them about our process, or if you want to share with them the end results of all of this. If you want to share the process, once we have consensus here, what we share with the technical work group will be available to all of the SME work group members if you want to reference it, but it won't necessarily be the final changes made until all this process has completed its entirety, if that makes sense.
Jessica, oh, there's the spreadsheet. Yeah.
just figuring out how to share with the browser mode. So essentially what we have here is in its penultimate form, what we'll send over for these definitions. And just what we're seeing here is in column B is the definition as originally written if it was existing. Column C just says if we're editing or clarifying or adding or removing or what have you. And then column D is exactly what is different about that definition, or if it's new, what is it? And in this column D, we have in bold is anything we added, and strike through is anything we took out. So really, in reviewing this, when we get to that point, or if you want to hop into Box and sneak a peek early, do it in preview mode, you can. It's that column D is really enough on its own to tell what was changed or what's different. And we do have some notes from earlier conversations over on the right too, if we need to reference for context, but they're not officially part of what we're doing, if that's any help. But you can see here is kind of like what we worked through today, things that we added and adjusted.
Thank you, Chris. So people can use that. If you're one who wants to kind of brief your leadership on the process and kind of how things got to the suggested definitions that we'll put forward, you could totally talk them through things with using that spreadsheet that's got all the changes and suggestions tracked in there. And then there will be a final version once we come to consensus and hear our final version. That's going to then go to the definitions technical work group where they're going to give some review and feedback, and then to the steering committee, and then we'll have a system-wide final version that comes out. And I mentioned at the beginning of the call, but September is the goal for the steering committee to get these definitions and start working through them. So it takes a while to go through the whole process and have the review everywhere that it needs to happen. But that's kind of the timeline of when you could expect to have updated definitions that are formally approved by steering committee. That helpful? Did we answer questions, concerns? So we are on the sub definitions. Is this plan or participate in? Is that one different in any way?
For that one, we took out the word annual.
Okay.
That is changed.
So not a major change, but I'll read it anyway. Plan or participate in and document regular emergency preparedness exercises, include community partners, some examples of who those are, in exercise design and implementation.
This is Jesse.
Go ahead.
I'm trying to think exercise design and implementation. Is it exercise design and conduct? Are we implementing the things, or are we talking about implementing the changes that are the corrective action plan items that come out of the exercise?
That's a great question.
This is Travis. Do note that we do have the fourth section, which really speaks to evaluation and after action reviews and corrective action plans. So hopefully the linkage from these previous three sections can really draw a line to that fourth section.
I would change the word implementation and make it exercise design and in exercise design and conduct.
Yeah, so the second sentence, include the community partners in exercise design and conduct. Does that capture everything that you would want to include your community partners for in terms of exercises?
Exercise design, yeah, I mean, conducting the exercise, I mean, yeah, it does.
Okay.
It definitely does.
Okay. Awesome. And I'll just pause here for a little bit and see if there's any other questions, concerns. Brian put in the chat design, planning, and conduct. Thank you, Brian. All right. Develop, train, and exercise the decision-making protocol to support agency leadership in making policy-level decisions during public health incidents.
These next two, develop and conduct, are the same as they were originally. And the third one, ensure training, was new.
Okay. Are we good with the develop and the conduct ones? Nobody gave feedback in previous sessions, but if you have a huge issue that you're noticing right now, please speak up. Hearing nothing, I'm gonna move on. Okay, ensure training addresses how the ESF8 response and public health response is coordinated within the jurisdiction's incident command system.
It's coordinated within. I mean, the incident command system is the incident command system, right? It's a tool, or public health response is coordinated within the jurisdiction's response protocols that including use of the incident command system. The thing that this says to me is that each jurisdiction might have their own incident command system, but they shouldn't, because the incident command system is just a tool. It's kind of like, Microsoft Word, Excel, that kind of thing. Within the
Yes.
Jurisdictions. Yeah.
Thank you. I'm wondering, so for this one, kind of catching that relationship and interaction between public health emergency response and emergency management, like maybe that is what it's trying to tease out. What do folks think about that second half of the statement? Do we need to be changing
Yeah,
it
I
up?
think the second half of the statement is just, it's really ensuring that local jurisdictions and DOH, it could be EMD, it could be any state agency that's responding to that same incident, that they can share information. They can share information between each agency. And Sue, can you help me on this? I could be stuck in a, but to be honest with you,
this does seem, that language does seem a little odd.
I would say within the jurisdiction's incident response protocols, including use of the incident command system. I don't.
Yeah, that makes sense.
Okay. Oh, nice. Very nice.
Good work, Travis.
And I see Chris's hand is up.
Yeah, I just had a little more context, I think, for that one, but I think those edits make it moot anyway. But just for maybe it's academically explained, but I think part of the discussion was within the jurisdiction was like pandemic, how many different incident command structures were set up in Washington State, and maybe that's where that distinction came from then. But I think that question goes away with the new wording.
And I think like from the tribal perspective, like the way that the wording is now, like it wouldn't limit them or be like making any funky requirements either. Thank you all. All right. Maintain and exercise procedures and agreements with healthcare, private sector, and community partners to request, receive, distribute, and dispense medical countermeasures for statewide and community-wide public health incidents.
Oh gosh, it's me again. Respond to public health emergencies. Ability to regularly execute response plans and processes, processes in order to respond to disaster and emergency. Ability to regularly execute response plans and processes respond to, I mean, I just think there's at least a couple of words missing on that. And we're not even on that one. We're on the next.
It's all good, Jesse.
If we're on maintain and exercise, that one is verbatim from the definitions.
Yeah.
Okay.
No, I looked down for a minute and then looked up at the highlighted one. So
Yeah.
I do see a
Simple.
question from Duncan. What is healthcare versus private sector?
good question.
$3M.
Yeah. Yeah.
So in emergency management, there is another word they use for that. I'm kind of gapping. And Sue, I hate to do this to you again. Can you remember private market,
Public-private partnership or something, I think was what DOH used for some of the COVID work.
yeah. Private nonprofit agreements with healthcare, private and nonprofit. Yeah, I don't know. But that's a great question, by the way, Duncan.
Would all of those be covered if we just said non-governmental organizations?
I'll bet it would. Maintain
Is that a standard term anymore?
I think that's our go-to standard term now, isn't it? The NGOs.
Mhm. Yeah, maintain and exercise procedures and agreements with, yeah, it is, yeah, with, but did we delete healthcare or do we need to put public agencies?
We could say non-governmental orgs including, and then do examples like we did for all the other things that we wanted to make sure we're highlighted.
Could we say something like between government and non-governmental organizations? Because I think
Yeah,
that's what was
maintain
missing. The
accessories
first part was the public
between.
part. Because originally it said something about healthcare and non. And so it didn't say that the healthcare was referencing public healthcare, even though that's what we all are, but still.
Yeah, because if it's an FPHS definition, it's for the different sectors of government to be able to have the procedures and agreements with these other entities that are non-governments. Does that capture everything? Do we want to put in there more language around between non-governmental and non-governmental partners?
I think that covers everything.
Okay. Okay, and I'm seeing some more thumbs up here. All right, I am going to scoot us to the next one then. Conduct training and exercise on the jurisdiction's ESF8 plans, public health plans, and any associated policies. I'm sorry if you can hear my dogs barking, they're outside, but of course they're outside my office window.
I think that one's brand new.
Okay. The next one is train staff and responders in health equity and disparities. And I believe that one's brand new too, isn't it? Clarifying a comment in the chat. If you're in this work group, please feel free to participate. You don't need to just feel like you're simply observing. You're all here for a reason, and we want all of your feedback. All right, the last one for the second section, train and exercise appropriate public health emergency response staff on information management systems used by public health and emergency management agencies. And there was a little bit of confusion in the old definition about like, what is an information management system? So I know we've had some conversations on that. But essentially anything you use to manage information that would be helpful to you during response. All right. We have about 10 minutes left. Do we want to just keep cruising on 3? How are we feeling right now? I don't think we're going to get to consensus today. Just keep cruising.
Yeah, I agree with
the
your
next
assessment,
two are-
Jessica.
The next 2
I
are
think we
pretty
should-
short, but I think we can cruise through.
Yeah, I agree with your assessment, Jessica. I think we're not going to get to consensus today. I think we should finish as much as we can and then just recap again process from here.
Okay. All right. 3. So this is the response part of the response cycle. Respond to public health emergencies, ability to regularly execute response plans and processes. We got some funky verbiage already. Respond to disaster emergency. So I think we meant to say ability to regularly execute response plans in response to disasters and emergencies. That's very response, but I think that one just broke my brain a little bit.
I think it's just ability to regularly execute response plans and processes in response to disaster emergency. There we go. Or I suppose you could take, no, just leave that there. Leave it the way it is. We've got a whole lot of response going on, but the reality is that's what this section is about. Oh, I like Reagan's. Yeah, I like that too.
And Reagan suggested in order to respond, so ability to regularly execute response plans and processes in order to respond. And then Cassie, I saw you're checking in to see if we still have time today for an update on the after hours program, or if we would like to reschedule that for another time. I think we are going to have to reschedule. Okay. The next sub definition here in this section, ability to assess need, request, order, manage, and store equipment and supplies necessary for public health emergency preparedness and response activities.
That's a new one.
Right. the
Maybe a
next
given in
one-
that, but should we add something about making sure that it's still current? We had a lot of supplies that expired. We weren't alone.
Yeah, do you think like refreshing your supplies and getting rid of expired stuff, would that count under management? I know we kind of went back and forth on that, I think in the last meeting.
Maybe add something about inventorying. Yeah, that's good. Rotate is good.
Nice.
Sweet. All right, the next one, maintain 24/7 notification system with capacity to triage and act on public health emergencies to include immediate response and staff notification / activation, should include staff coverage and availability as appropriate for urgent public health issues. Seeing a thumbs up. All right, I think we can move along. We'll probably do this next one and then pause or just wrap it up with next steps. So use the incident command system to determine objectives and address the health needs of those affected, develop situational assessments to determine the functionality of critical public health operations, critical healthcare facilities, critical infrastructure, and the number of ill, injured, and deceased, identify and allocate resources to address public health needs, return to routine operations. Right. So when we meet again, we will these definitions, work to come to consensus on these definitions. We also sent out already a poll on the access to care definitions. We will be working to get that queued up so we can kind of do a similar process with those, but we'll work on wrapping up the emergency preparedness definitions first. So we'll finish going through these in the same way that we were. Yeah, and we have a scheduled meeting for May 28th, but we are going to have a lot to get done at that one. So we're probably going to need to make it a longer meeting. If you already know you have conflicts or everybody's going to have a conflict during that meeting because of some other crazy meeting, let us know because we want to try to get through consensus and we need people to do that. Anybody else from the co-leads or Chris, you want to add anything before we wrap up for the day? Thank you all. I know that's like painful to have someone read at you and try to wordsmith on the fly.
I don't think anything to add on this end at this point, but good job, Jessica, and good job, everybody here. It's a slog.
Yeah, I'll echo that. I mean, this is a really critically important process because it really does provide the parameters or the boundaries of which funding will be spent on in the future. And so, Jessica, thank you so much for your leadership and kind of working us through this process. It is difficult when everyone's at a different point of understanding, and familiar with the work or not. So great job pulling us all forward and getting through a lot of the definitions today.
Thank you all so much, and I appreciate your feedback and being willing to kind of give it on the fly. I know it's a lot. So once we're through this, though, I think that'll be the last time we update definitions for a couple years again. So that's an exciting finish line to get to. All right. Well, if anybody needs anything before the next meeting, please feel free to reach out to us. You have all of our info. But otherwise, we'll see you again soon, probably at another meeting. Bye, y'all.